I wake up in the morning sometimes feeling like I played a game of football in my sleep.
At the age of just 34, former stonemason Braden Barnes is too sick to work. He has accelerated silicosis, a lung disease which leaves him breathless.
Yeah, shortness of breath. I could just be sitting on the couch and have to take deep breaths, and that's not even doing anything, and then let alone playing with my kids.
Engineered stone has silica levels of up to 90%, and when it's cut and polished, fine dust particles are released.
That gets down into the bottom of the lung, and then that triggers a scarring reaction in the lung. So then that essentially clogs up and distorts the lung, so it can't work.
The silicosis crisis was first identified in Queensland 12 months ago, and a national task force has begun work to ensure there's a consistent approach. Dr. Graham Edwards is a key member.
Every single case of silicosis is prima facie evidence of system failure.
New figures obtained by 730 show a surge in new cases as awareness grows. Queensland and Victoria have the most. In South Australia, more than 60 people need specialist follow-up, and new cases have also been discovered in other parts of the country.
2 deaths, one in Queensland and one in New South Wales. I'm aware of at least 2 transplants.
I know 6 of my friends that have been diagnosed. I know a few more that are in denial. They've built their life around the money they earn, so they don't even really want to get checked.
In Queensland, there's been urgent audits of stonemason businesses to make sure unsafe work practices stop. So far, almost 600 notices have been issued. 730 has exclusively obtained audits of 2 Gold Coast businesses. At Coomera Stoneworks, an inspector found workers were placed at risk by cutting stone without adequate masks.
Well, it's inconsistent with safe work practice, full stop. Very concerning. They might not have the silicosis today, but what it's doing is loading up those lungs so they can develop silicosis tomorrow.
Inside another workshop run by marble and granite specialists, an inspector photographed these conditions in October last year.
They show a surface contamination in the background, in the footprints, the surfaces of this forklift. We can see it in the background of this photo of the workspace. You can see the dust and the footprints.
The business did not respond to questions from 730, but maintains it is the cleanest workplace in southeast Queensland.
This is my most proud one. This is my leading goal kicker for the league. I'm sad to see that my footy career is done and dusted at the age of 34.
In Victoria, the crackdown has led to a ban on the dangerous practice known as dry cutting. But it's too late to protect Braden.
A very dangerous product, so it should have been monitored a long time ago, especially the Caesar stone. At least more warnings and bigger stickers.
It's really changed our lives. We used to be quite active family, and sorry.
My doctors have recommended that I leave the industry. Who's going to pay my bills?
Sydney stonemason Andrew Cloak is seeing his specialist at St Vincent's Hospital.
And you can see that it's rather like a snowstorm. You can see that there are lots and lots of these little dots, and these little dots are where the body has reacted to the silica.
After 30 years in the industry, he has silicosis, but his lungs were only checked for the first time in January.
I was dumbfounded. So many questions went through my head. Where has safe work been all this time? This, after 32 years, is my first lung examination.
do one of those.
Andrew can't afford to quit, and he's frightened his condition will worsen. He wants a New South Wales workers' compensation system known as iCare to support him while he retrains, like in other states.
They've only offered my travel to my doctors. They've offered to pay for my doctor's fees. Beyond that, no. They've offered to come and clean my house a couple of times. It's New South Wales is playing catch-up to the rest of the country, yet again.
We still don't have any real visibility about what's happening in New South Wales. We just don't know the quantity of cases.
But one of the problems they're facing now.
Lawyer Jonathan Walsh believes New South Wales is lagging behind other states. He's given evidence to a parliamentary inquiry calling for health screening of all workers, removal of caps on medical expenses and a ban on dry cutting.
And so the focus must be, like it is here in Queensland, to get those workers who are excessively exposed to dust, who developed silicosis unbeknownst to them, get them out of that industry.
I believe we actually have the most comprehensive response in the country. We have issued 600 notices. 39 of those notices are prohibitions, which are a ban on the dry cutting. In regards to payment of screening, screening in New South Wales has been occurring for 20 years, and it is free to workers.
One pressing issue remains whether engineered stone can be cut safely or whether it should be banned.
Just be banned. There's no way you can produce a kitchen without having some sort of dust come off the manufacturing process.
The nature of the product in and of itself potentially can lead to an industry that is viable and safe. But we're not there yet.
Braden Barnes is spending precious time with his family while he waits anxiously to see if the disease progresses.
I don't even know what the next 5 years could bring, let alone the next 10 years. A lung transplant, maybe on the cards. That's the scariest thing, is the not knowing, living day by day.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.